Okay, great. Well, welcome everybody. Looks like we have 20-ish folks online. Thanks so much for being with us this evening or this afternoon, wherever you're calling in from. Um, yeah, you can go to the next slide, Susan. So my name is Andy Jones. I'm a faculty member in the Department of Nutritional Sciences at University of Michigan. Currently serving as the associate chair of the department as well. And we have with us as well from our department, Dr. Kate Bauer, who's an associate professor in our department. She's also the chair of our admissions committee. Susan Aronson, who is our dietetic program director, and also Carol Durgee, who is the student services coordinator. So yeah, so that's we're kind of representing the larger department this evening. And the student alumni panel, that's happening after this. Is that right, Susan?
Yep, yeah, they'll be joining us no later than 7:40, and that will be towards the end of the program.
Okay, great. You can go to the next slide. So we wanted to just spend a little bit of time telling you just at a glance who we are as a department and giving you a little sense of what's going on here. So we're, a moderate-sized department. We have 35 faculty members in the department. We have as many joint faculty as core, and that means those are faculty members who have an appointment in another unit on campus, maybe in the medical school or elsewhere, but they also are affiliated with our department. They may advise students, they may teach courses, and they may get involved in advising in some ways. So we're a very diverse group. We have 46 different nutritional sciences specific courses. So there's a very large number of courses given the relatively moderate size of our department. And we have 93 current students. You can see most of our students are in the Master of Public Health program. We have a smaller but growing Master of Science degree, as well as a pretty robust PhD program. We currently have 16 PhD students, and we have a large number of alumni now. Our department is relatively new. It was began in 2015, but nutritional sciences or nutrition at University of Michigan has been around since the inception of the School of Public Health, which is, I believe, in the 1940s, if I'm not mistaken. So there's been a nutritional presence at University of Michigan for a long time now, and having our own department now is a real strength of being in nutrition at Michigan. So you can go to the next slide. So we have as I mentioned, a pretty diverse faculty, and as a result, we have a lot of different research strengths. Our faculty, I know we do a lot of teaching, but a big part of what we do is going out and asking what we think are interesting questions and trying to find answers to them. So we have, a core area of expertise in biosocial and early life environmental exposures. So looking at impacts on metabolism, intergenerational patterns of growth, looking at metabolic syndrome and the epigenome. We have experience sort of in the core of nutritional epidemiology, looking at associations between dietary patterns and different kinds of health outcomes. Our faculty look at impacts of diet on impact of weight on metabolic regulation and disease, the role of micronutrients in human health and disease. So we have a really strong representation there. We look at social and behavioral determinants of diet and weight as well. So our faculty have expertise looking at the influence of the family on these outcomes, looking at socioeconomic stressors. What is the role of food insecurity in driving some of these outcomes? Looking at the eating disorders. So there's a big area around social behavioral determinants as well. And we also have some expertise looking at food systems, which is understanding where our food comes from, how agricultural production has impacts downstream on diets, on health, on nutritional status, and understanding the impacts of those systems on sustainability and on the environment as well. So lots of different areas. And so there's lots to get involved in if you were to come here, both in terms of getting involved with research, but also the classes, the courses that are taught in those areas based on our faculty's expertise. Yeah, next slide. So just a couple quick items here to, why nutrition at U of M. There's other nutritional sciences programs around the country. Why would you come here? We're pretty unique in the sense that we are embedded within a school of public health. So there are 5 other departments in our school. And so the students in our department have a lot of opportunity to interact with faculty in many different areas in the context of public health, which is fairly unique in terms of nutritional sciences. And a lot of our faculty come from that background, and we sort of take a public health lens and perspective on the work that we do. We have a graduate didactic program in dietetics with an affiliated dietetic internship program. And so this is a real advantage for students interested in pursuing the dietetic internship. It's an option for students whether you're in the MPH or the MS program who are seeking a dietitian credential. And you can actually apply through a pre-select process. So if you have more questions about that, I'm sure we can have some answers more about the program throughout the evening. There's a number of scholarships and fellowships available to applicants to the program. The Nutritional Sciences Award. We have a new program called the Transformative Food Systems Fellowship, which I can talk a little bit more about if there's time. For returned Peace Corps volunteers, there's the Coverdell Fellows Program, and a specialty award. Perhaps, Carol, so you could speak a little bit more about some of the differences between these awards. I'd be happy to jump in about the Transformative Food Systems Fellowship part of this. And there's the option to pursue dual master's degrees. We have a lot of students that have done this in the past, whether it be with social work or with other policy or other areas around the university. We have U of M is huge, so there's lots of diversity in terms of the courses you could take even outside of our school, despite the fact that our school is quite big. So a lot of opportunities to pursue other courses, outside of public health or even degree programs. Lots of elective courses and focus areas and certificate options. Our faculty are very approachable. A lot of us are in a hybrid format now, some at home, some coming into work on a few days a week, but that's going to be ramping back up, I'm sure, in the coming semesters. But a real strength of our department is the advising we offer to students and the ability to really have a lot of one-on-one time with our faculty, given the relatively small size of our department. We have a lot of student organizations, both within public health, but also across the university for students to get involved in. And so there's the problem is having too many opportunities to get involved here, not having a lack thereof. So a lot of our students are, very busy, and they're able to engage at whatever level they like when they come here.
How about if we just take a second just to pause, because there's a lot of information on that slide, and Andy's just going to be with us probably for about the first 15 or 20 minutes in case there's any specific questions. So does anybody feel free to unmute yourself or add it to the chat? Does anybody have a specific question about any of the things that were mentioned here, scholarships, fellowships, anything else?
I have a quick question.
Great.
If we're not going to hear more about it later, I'd love to hear a little bit more about the Nutritional Sciences Award and what that looks like and how that process works.
Kate, did you want to answer that since you're the chair of admissions?
Yes. I'm just trying to look ahead. I don't know if we specifically talk about it in the slides, so I'll take a little more time right now to give the details. And Carol, can you put in the chat our new website about our funding opportunities? Because this is the first year that we have made explicit how we fund our students and how you can become eligible for these awards. So the Nutritional Sciences Award, it doesn't matter to you guys. It used to be something called the Dean's Award. We, every year as a department, have a pot of money to support students. Obviously, we know that graduate school is very expensive, and we want to attract the best and the brightest. And a real priority for us is matriculating a student group that is diverse in experiences, diverse in where you're coming from, diverse in backgrounds, all those types of things. So basically, the Nutritional Sciences Award generally ranges from about a 50% scholarship to a quarter scholarship. We do occasionally have little bits, pots of money that we try to spread it even further. The key things for the Nutritional Sciences Award is that you do not, and actually all of these, you do not have to apply separately for them. It is about what you put in your application, Particularly, we want to show us that diversity, show us the volunteer work you've done. Clearly tell us if you've done Peace Corps, because we want to give someone that money. Tell us if you're interested in sustainable food systems, right? Like really be specific of who are you? What have you done? Why are you coming to Michigan? We also look for things like, are you a first gen college student? Are you the first in your family to be a US citizen? Did you receive a Pell Grant? And so those questions are all on the application. We just really encourage people to be careful because that information is really important. Like if you did receive a Pell Grant for undergrad and didn't note it, you're missing out on funding. So basically all of the information we will need to determine awards is going to be in your application. And at the same time, we're reviewing your application for its merit and your admissibility. We are looking at you for these scholarship opportunities. And we generally tell you your admission status early February. We're trying to get a little earlier, and your funding information will come a bit after that. I would also just say, please, as Andy said, we're very approachable and we always want to understand your personal circumstances and try to make Michigan work. So if, certainly with COVID, we've had a lot of families change economic circumstances, things like that. We want to hear that. It is not a weakness for you to come and tell us, what's going on in your life and why you may need a little extra support. So that was a lot, but hopefully that answered your question.
It did. Thank you.
Did anybody have any additional questions about anything that's on this slide?
Susan, maybe I could also say a word or two about the Transformative Food Systems Fellowship just now, because I won't be able to stay on the call the whole time.
Yes, please do.
I believe I think I saw, Kate, maybe you put it in the chat, a link to the fellowship page. So we have a page on through the public health website where you can take a look at some information about it. But briefly, this is a fellowship opportunity that was funded through the USDA that is allowing us to bring in a cohort of 12 master's students over the course of the next 2 years. And there will be students that are going to be admitted into nutritional sciences, students that will be admitted into the School for Environment and Sustainability, which is a different unit on campus, and also the Urban and Regional Planning Program, which is also a different unit. So we'll have a few students here and a few students in those other units who will be coming together as one cohort. They'll be taking classes in their respective programs, doing their own degrees, but they'll be coming together for a part of this program with some shared requirements around certain kinds of classes they'll be taking, certain seminars. There's an expectation that you'll be doing some kind of field experience related to food systems, which can be double counted with the public health requirements for either an internship or a thesis project. And importantly, there's funding attached to this too. You'll be prioritized for some of the funding that Dr. Bauer just talked about. There will be a stipend that will be provided for each year of the 2-year master's program that you'd be involved in, as well as potentially some funding to cover internship expenses. So in terms of eligibility, we're looking for students who identify as underrepresented, first generation or low income, and who aim to study food systems. So if you need to be admitted into our program if you're interested in applying through nutritional sciences. So there will be that sort of separate review process to be admitted into a department, but then there's also a separate application form which is on our website, which you can find there and fill out. And that would be due on January 31st of next year to get that application completed. And if you're admitted into our program, we'll look at the application and assess eligibility at that time. So if you have specific questions about the fellowship, you're welcome to get in touch with me. There's also some other folks on the website you can take a look at who are the directors of the program, Dr. Leslie Huey and Dr. Yvette Perfecto. So,
Andy, can you just confirm again, is the fellowship only for master's students or are PhD students eligible?
It's just master's students.
Okay, thank you. Someone had a question.
Yeah, but it could be MPH or MS, depending on anyone.
Great, thank you. We also will have an opportunity at the end of the program tonight for more questions and answers. So maybe we should move on to the next slide. Please feel free throughout the whole program to add your questions to the chat, and whichever one of us sees it and has the answer, we will respond.
You're off the hook, Andy. You can go put your kiddos to bed.
Mom's doing that right now.
Oh, okay. And you might
So
not be off the hook. Now I realize this is your slide too.
Yeah, this is my slide. Okay. But, I think what's on this slide basically reiterates a lot of what I had discussed earlier in terms of the opportunities that you have to, to be once you're here at U of M for engaging in research, the diversity of different kinds of research programs that we work on here, the collaborative aspect and engaging, faculty here, the ability to actually, engage with us. There's lots of pools of funding for travel and conferences and research. I mean, beyond just funding once you're to fund your actual tuition in here, but once you're actually here, you'll find there's lots of opportunities to go to conferences, or if you want to do an internship somewhere else, to travel. We have a wonderful program for students interested in doing internships in another country to provide funding for that. That's been in a weird state for the past 2 years because of COVID, but again, that's going to be rebounding. So a lot of different, a lot of different opportunities here, in addition to just the sense of community that we feel that we really enjoy that aspect of being here as faculty, but we hear it from students as well. So, and we're fun.
Andy, can you answer the question, the fellowship that you were talking about, is that just for U.S. citizens?
Yes, it's U.S. citizens. I believe also permanent residents are eligible. Let me just take a quick look at that and I'll confirm.
Okay, thank you.
I'll pop that in the chat if I can find it here in the next few minutes.
Upstairs.
I'm sorry, I've got a kid issue. Can you please? I need to be on this call. Thank you.
I cannot keep her downstairs.
Okay. Is it me?
That's COVID.
Yeah. All right. I'm just gonna.
Keep her down.
Noah, I got it. Thank you.
We like dogs and kids, Kate.
Except when they're not doing what I just asked them to. Anyway. So now you're off the hook, Andy. Thank you.
Awesome.
Thanks, Andy.
Thank you, guys.
All right. So moving on, kind of the last little bit of why you should think about Michigan. And thank you, Marilyn. I just saw your note in the chat. Why you should think about Michigan and Ann Arbor. Ann Arbor is where we are located, and an incredible, incredible college town. We're going to do some introductions in a bit, and so we'll learn if some of you are already here for undergrad or maybe grew up here. But we certainly do know that some of you are coming from across the country, across the world, and in the times of COVID may not have a chance to come to campus and join us. So we really wanted to share with you some of the really wonderful things about Ann Arbor. Ann Arbor has consistently been voted a best city to live in America, best college town, most educated city. We have I think the university attracts all of the great things of a big city to our fun little town, which also has a huge football stadium where 110,000 people come many Saturdays in the fall. So just to give you a little background, I grew up in New York. I lived in Philadelphia. I lived in Minneapolis. I've lived a lot of places, Atlanta. And Ann Arbor is really, really unique. And it's just it's a lovely size. You get to know people, around town. It's easy to get around. So anyway, we really love Ann Arbor, and particularly if you are not able to make it here before you make a decision, we are happy to connect you with current students to learn about housing, to learn about transportation. I believe we have some videos on this SPH website about life in Ann Arbor. So just as a quick intro to my colleagues, Susan and Carol. Susan, can I throw to you, what is your favorite thing to do or your favorite thing about Ann Arbor?
Well, I would say this time of year, my favorite thing about Ann Arbor is the Ann Arbor Farmers Market. I went last Saturday and it was just plentiful. In fact, right now in my kitchen, I think my husband and son are cooking some of the Romanesco and fennel that we have. So just, there's incredible amounts of produce that grow locally. So it's a really fun place to go on a Saturday morning, on a beautiful fall Saturday morning. So I'd say that's top of the list today, this week. Carol, how about you?
Carol?
I would have to say I love Ann Arbor in the sense it's a walkable and bikeable city, and so you really can get around even in the winter. So that is definitely my favorite thing. And also, like Susan was saying, we're surrounded by farms also, so you can really, if you want to get out of this small little city, you can also get out and go hiking or canoeing. So there's just a lot to do outside, even in all months of living in Michigan. So I've been here, I came here for grad school and I never left. So I love it.
And I will say, I often in the winter drive by Carol walking to work when it's 0 degrees. And I'm always like, Carol, hop in my car. And she's like, no, I want to walk. So she's serious about her cold weather enjoyment.
Well, you have to embrace it. You have to, strap on the snowshoes and embrace the snow and the cold and just buy a really nice coat. We've had students from California and Florida and places all over the world with a warm climate, and everybody survives, thrives, and does just fine. So, okay, I'll move on to the next slide?
Yes, we'll turn it to Carol.
Okay, so we're gonna just stop for a moment and just find out who's on this call tonight. We're really happy that you're here. And I went through the registration, and so you can just see that we have a variety of people we have high school students, undergrads, graduate students, but we also have people who are working professionals. And so each year our cohorts are really made up of a variety of people from all different walks of life, which I think just adds to the classroom and just to your experience as a graduate student. But what we'd like to do, if you would like to turn on your camera, and I'm wondering, Susan, if we can take the slides down just for a second while we do this. We would love to know where you're calling from, or calling in from. So we have, I was going to ask first if anybody is here from Ann Arbor and if they would like to turn on their camera and tell us your favorite thing about Ann Arbor. Or even, I know people are from Ypsilanti, we have calls in from Canton, different areas of Michigan. So does anybody want to sell others on Michigan, why you love it here? Any takers? And if not, that's okay.
I could say something.
Thank you.
I really like how diverse Ann Arbor is. There's so many different cultures and different restaurants. It's pretty cool.
Okay, thank you.
I could go too.
Great.
So I grew up here, and honestly, my best decision in all of college was to stay here and go to school at Michigan. Being close to home is really nice, and also I think that U of M provides a great balance between a hard work atmosphere and also having fun, like studying all week and then going out to dinner downtown with all my friends.
Awesome. Thanks for sharing. All right, anybody else? All right, well, what I'd like to do now is if I'm going to call out some different spots in Michigan, and then we're going to go through some continents, and it would be great if you wanted to use the emoji and give us a thumbs up, or if you want to shout out hello, or if you just want to put where you're calling in from in the chat. So we're just going to take a few minutes to do this. And so I'm going to start with Michigan. So who's from Michigan? If you want to shout out or put your thumbs up.
Hi, everyone. Can I just share my experience?
Yes.
Yeah, my name is Muldir. I'm from originally Kazakhstan, Central Asia, and I'm in East Lansing for 2 years now. And I love the weather here, and the nature is awesome, and the people are nice. And I've been in Arbor for one time, and it's a bit different from East Lansing,
Mhm.
so it's, I would say, nicer.
Yeah, it's busier, isn't it? than East
Easier, and the campus is just incredible.
Yeah. Well, great.
Yeah.
Well, thank you. It's nice to know that you're in East Lansing.
Yeah.
Yeah, good. All right, so I'm going to go through and just call out. So we've got anyone, Detroit, East Lansing, Canton, and then we're going to move on to Illinois, Ohio, Florida, California, Vermont. All right. New York, Massachusetts, Tennessee, Virginia, Texas. Okay. So now we've done North America. I think we might have someone on the call even from Canada tonight, possibly. And we do have a few students in our program this year who are from Canada. And then we are just I'm gonna go through the continents. So I believe we have someone here from South America this evening. And then Africa, Nigeria, and Ethiopia. I know for some students it's 2 a.m. in the morning, so they were not going to be logging on. They'll be listening to the recording when it's available. We also had someone register from Europe, from France. Well, all right, we have someone from Nigeria on the call. And then the Middle East. I know someone's on the call from Lebanon.
Yes. Hello, Hanin.
Welcome.
Thank you.
In Asia, China, Taiwan, the Philippines. Oh, and someone's from Brazil. Excellent. And then I didn't see anyone who registered from Australia, but we'll throw it out there. Okay. Well, thank you everybody for being here. Excellent. Well, welcome. And I am going to turn it over to Susan, or to Kate, actually.
Yes. All right. So what I'm going to do fairly quickly is go through the basics of our applying and our application process. Carol is going to share in the chat. Again, we have, this year we made a real effort over the summer to get as much information as possible up on our website, just being totally straightforward with you. Like, this is what we want to see from you. If you follow this, check, 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 you will get all the components. So please take the time to look at our website. And of course, we are always available to answer questions individually. Next slide, Susan. Okay, so the bottom line is that, right, we have 3 degree options: an MS, a PhD, and an MPH. And in a little bit, we'll talk about what the differences between those are. But the bottom line of this slide is that if you are applying to the MS or the PhD, they are administered through the Rackham Graduate School at the University of Michigan. Meanwhile, the MPH is administered through our School of Public Health, and we use the SOFIS system. So if you're applying to other schools of public health, it's super easy. You go into SOFIS, you click, 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 and your application gets out to many schools of public health. So the important things to keep in mind, the early deadline for domestic MPH applications is December 1, and we have a hard deadline of May 15th, 2022 for domestic students. Please don't wait until May 15th. When we talk about early deadlines, what that means is that that is when we are giving out the money. You are most likely, if your application, hits those marks for merit and diversity and need, we will evaluate that early. So the earlier you can get in your application, the best chance you have of applying during a time when there's, a bigger pot of money. For our international MPH applicants, we do need you to apply by January 15th. There is a really strict cutoff with that. As I'm sure there's all sorts of visa and international travel things that we want to work out with you. Meanwhile, the Rackham priority deadlines for PhD applicants is December 1. We do look at PhD applications in December. So that is, if you are really interested in that, I'm also going to encourage you again, please go to our website, look at our tips for applying for a PhD. It is not like a master's degree. A PhD is all about finding that mentor match, finding someone in the department who can advise you and help you build and become a scientist in the area you want. And then our MS application early deadline is December 1, and the official deadline is May 15th. So a lot of details, but it is all on the website. Okay, next slide. All right, so again, this is straight from our website. So you can go back to this at any time as you're working through building your application. So what does a successful, I'm sorry, now my husband is behind me. What does a successful application look like? So we look at these 5 areas. And the important thing to keep in mind is we do a really holistic review of our students. As I mentioned, we want students who, were strong in undergrad. If you were not so strong in undergrad, that's fine. Maybe you have great volunteer experiences. Maybe you were a physics major in undergrad and then did something in your professional life that made you realize that nutrition is your passion. That is awesome. We want all types of students. So we are going to be looking at your academic record. Really important is these statements, these personal statements. Take the time to talk about why nutritional sciences and why Michigan. This is not a deal breaker, but we get a few applications every year that's like, here's why I want to apply to Harvard. And that doesn't make us feel so good. So make sure to change the name of the university in your statement. We look for strong letters of recommendation. This is really, really important. Please make sure to get people. So we ask for 3 letters. Ideally, 1 or 2 can talk about your academic background. Maybe it's a professor that you did a little extra work with in undergrad, worked with over the summer, developed a good relationship with them while taking their course. And then 1 or 2 recommendation letters from a volunteer experience, a professional experience, someone who can speak to your maturity, your leadership skills, your teamwork, your communication, right? All of those are things that we really want to see in a student. As I mentioned before, we want to know, if you had a tough patch. We know that people have health issues, have family issues, have financial issues. It is absolutely acceptable to talk about that in your application. If you didn't do so well in a course because you were going through a tough time, be honest about it, and we can absolutely, try to sort of help you figure out, like, okay, do you still meet our requirements, or do you maybe need a little extra academic experience? And then this is also super important. So I'm going to talk about our prereqs in a second. You do not have to have all of them done on the day you apply. We would love to see that, certainly. But it's really important, if you haven't met some of our prereqs, that you talk about what your plan is to meet those before the time, through the winter and spring of 2022. Carol has a lot of resources for how you could take an online class, how you could take a class at a community college, all those types of things to get those prereqs done. But we need to be able to have a conversation about what your plan is. All right, next slide. So just briefly, here are prereqs. You'll see, just make note that calculus is only required for our MS and our PhD students or applicants. you know, if you had sort of a non-traditional course in one of these and you'd like it to apply for the prereqs, again, just be transparent with us. We may come back and ask you for a syllabus, something like that. But we really, Susan and Carol are incredible in working with students. We don't want this to be a barrier, but we do really need you to have met these prereqs before you show up on campus. And so as I mentioned, again, if you're currently enrolled or you're planning to take one, please include that in your application. All right, Susan, I think that's it.
Great, thanks so much, Kate. And so we'll have a few minutes to go through curriculum because, you know, standing on the call are some wonderful students and an alumni who joined us, and we really want to be sensitive to their time. So I'm going to do a very high level curriculum conversation, but we're also available for Q&A afterwards, and much of this information is also available on our website. So the first thing that I'm going to briefly talk about is our MPH degree overall. So every student within our department who is seeking an MPH degree will fulfill all of these broad categories. I know there's a lot of words here on this particular slide, but basically what you're doing is you're taking a breadth of classes, meaning that you're taking classes in all of the various different departments within the School of Public Health. And that's what's represented there. You're going to be taking 4 core nutritional sciences courses because we really feel like this is the foundation for all of the knowledge that you'll learn in future semesters and primarily in your second year. You're going to be taking this broad perspective. So every year during your first year, and most students actually in their second year will continue on, we have a weekly, sometimes it's every other week, but a nutritional sciences seminar where we bring in researchers from across campus and across the country and sometimes internationally to talk about their research so that you can learn from them. There's a professional perspective capstone project and course where you'll have the opportunity to present the internship poster that you develop, and we will ask you through a series of activities to also develop what we call these apex products, but high detail I'm not going to get into at this point. But basically you'll have a chance to present a poster as if you're at a professional meeting, and it's a really wonderful way to interact with all of the faculty and to prepare you for the future. And then in addition to all of these core requirements that you will be taking, you'll have some room to take some elective courses. And like Dr. Jones mentioned earlier, we have such a wonderful group of faculty in many niche areas. So there is an abundant number of elective classes that you have the option of taking. All MPH students are also required to complete an internship, and that MPH internship occurs between year 1 and year 2. Additionally, on this call, we have students that are seeking the MS and the PhD degree. Like the MPH program, there are a breadth of courses that you'll take, but you'll take many less courses in other departments within the School of Public Health because this is a research-based degree. You will complete some modules in public health. You are in a School of Public Health, so we ask you to have some basic understanding of things like the social determinants of health and making sure that you understand the influences of the environment on public health. So you will complete some online modules and take an exam on that. You additionally will take those core courses in nutritional sciences, but the core of what you'll be doing in the 2 years and the 32 to 34 credits that you'll be taking in your MS degree, and of course more in your PhD, is the thesis and the dissertation research that you'll be completing. You'll be working one-on-one with one of our faculty members as your mentor. Obviously, in the MS degree, you'll be working with a mentor doing more of a side project on some original research that they are particularly working on, and you'll be doing a much larger dissertation if you're in the PhD program. So you are supported by not only your mentor, but both in the MS degree and in the PhD degree, you'll have a committee of experts who will help you to design and execute your research plan. You'll work alongside them. You'll meet frequently. You may even be doing rotations in some of their labs or working with them on their research if they're part of the committee. So they're really there to support you in all aspects of either the thesis or the dissertation. This question actually came up in the chat, and it's probably one of the biggest questions that we receive when we're reviewing an applications, and also even sometimes within right before the courses start in the fall, is a difference between the two degrees. I won't go through all of this. You will have access to these slides, but just kind of very broadly, the Masters of Science and the Masters of Public Health degree you're required to complete two completely different credit levels. Like I mentioned, with the MS degree, it's 32 to 34 credits if you're not adding dietetics onto it. With the Masters of Public Health, it's a 60 credit program. Remember, we talked about that breadth of classes and the public health exposure. So there's a lot of credits in that breadth that you will need to complete. The MS is primarily research, whereas the public health is more course-based. Evaluations occur in courses in the public health degree, and then more by the thesis committee in the MS degree. I think that, I think the goals here are stated. I think actually we're obtaining and understanding knowledge in both of these degrees, but there's a stronger emphasis, as stated under the MS, for obtaining new knowledge and then understanding current knowledge in the public health degree. I'd like to say that, the Masters of Public Health is what we would call a terminal degree, but we often have equal numbers of Masters of Public Health students as we have Masters of Science students that go on to do the PhD degree. So you may take a pause with your MPH degree, work in the professional field, then come back into the PhD, or you may go directly from your MPH into a PhD degree if that's what you're interested in. And with the Masters of Science, it's really learning how to be a scientist. Many students, when they complete their MS degree, they may stay in academics. They may choose to go on to do a PhD. They may work in research settings, research coordination. Some, will go on with the MS and combined RD degree to actually work in labs that perhaps design baby formulas or other types of food science type related careers. And again, like we talked about, your summers between year 1 and year 2 are completely dedicated to 2 different pursuits, depending on if you're in the MS or the MPH degree. The MS, you'll be working on your research, and in the MPH, you'll be completing that internship that you're required to do.
Susan, I think the thing for me, because again, many students have this question of MS or MPH. Right. And what we find, and you can see by our numbers, is that more students do pick the MPH, right? They want that breadth. They want to understand nutrition in a public health context. They want to go and get sort of practical experience through the internship through that. The MS is, again, research focused. So if you are one of these people who has questions in their mind, who is like, I want to be a scientist, I want to be a researcher, then the MS is for you. If you're someone who wants to learn about sort of nutrition and practice in the real world, the MPH is for you. And I say this because we do see a lot of students thinking they want to do the MS and then getting here and saying, God, the MPH is so awesome. I get to be exposed to so many things. So that's just something, a little ahead of the game advice that from what I'm seeing.
Yeah, and I think another thing to kind of add to that also is if you are in the MPH degree, it doesn't necessarily preclude you from doing any type of research or working on a research project also. So you might not dive as deeply into that particular research, and you obviously won't be completing a thesis, but you have an opportunity to work alongside faculty and participate perhaps in their labs and the research projects and the teams that they have. There are various different faculty members that have, weekly research meetings that you could be invited to work alongside with them, and also to do some independent studies. So, but in the MS degree, you have to have a very strong desire to dedicate a large portion of those 2 years that you're here to working on this thesis. So that will take a tremendous amount of time away from the coursework that you would take in the MPH degree. So, finally, we want to talk just a bit about concentrations, themes, and certificates. Like it was said earlier, so I do direct the dietetics program within the School of Public Health here in our department. And the dietetics concentration is by far the most, I would say, popular concentration that we have. And the majority, usually around 70% of our students are in the dietetics concentration, or they come to us already with a dietetics credential and they want to complete our dietetic internship. It's really a 3-step process. You'll need to take your credits, 17 additional credits that are all focused. These are courses like medical nutritional therapy, nutritional counseling, maternal and child nutrition. So you'll take an additional 17 credits. So that is for the one thing I should point out for the MS degree, that is above and beyond the 32 to 34 credits that you need to complete. So with the MPH degree, since it's a broader 60 credit degree, those 17 credits are included within those 60 credits. So you still have a small amount of room for electives, but much less if you're not in the dietetics concentration. The second step of that is completing a dietetic internship. We do have our own internship here at the U of M School of Public Health, and many of our students stay here to complete that. And that occurs after you graduate with either your MPH or your MS degree. And then after that internship, which if you stay with us, it's around 8 months. If you go to a different program, it could be as much as 12 months. You then would sit for your RD exam. You would take that exam, you'd pass it successfully, and then you would be credentialed with your RD. So it is this 3-step process, and I'd be happy to answer more questions about that. We have an additional focus area, a sustainable food systems focus area. Dr. Jones, who was on the call earlier, that is his specialty and his niche. So there is a cluster of courses that you can take around that particular focus area. And then we have many certificates. So we have a new residential maternal and child nutrition certificate. It used to be a focus area, but now it's a full-blown certificate. We have a joint certificate with kinesiology for students that are interested in physical activity in addition to nutrition. The other, probably one of the more popular certificates that our students in our department take is the global health. Carol probably linked in the chat all of the other certificates that are available both within the School of Public Health, and we have a lot of affiliate certificates with other schools and colleges across campus. It's a little bit of a challenge if you're in the MPH degree with the dietetics concentration to also do a certificate, but it happens. We have students who do that. It may mean you would graduate with 65 credits instead of 60 credits. Much easier to do this if you're in the non-dietetics concentration. So in the MPH degree, you're either in dietetics or you're getting an MPH in nutritional sciences with no concentration. And if you are in that track, then you specifically would be able to take some of these certificates without it being burdensome every semester. And then my final slide before we jump into the student and alumni panel, we just wanted to show you, we've talked a lot about the diversity of our department, the diversity of our faculty, the elective courses that are offered in a variety of areas. And this is annually we'll do an outcome survey where we'll reach out to our students, 1 to 2 years after they've graduated. We're like, where are you? What are you doing? What sector are you working in? Tell us the name of the company that you're working for. And this just is a snippet of time from, I believe, our 2019 in combination with some of perhaps our 2020 data. And you can see that a large number of our graduates are actually working in the health provider hospital setting. That's not surprising because, as I said, there's a large percentage of our students that are seeking the RD credential, and these are some of the entry-level jobs that they'll take upon graduation. We have students working for the federal government. We have students, an example of a student that works currently for the FDA, another student for the USDA, students that stay in academics, many students that go to nonprofit organizations, and so forth and so on. This changes depending upon the cohort and the interest of the students, but it's a pretty good representation of the breadth of where all of our students go after they graduate. We like to continue to stay in touch with you and know where you are. And we like to see your career trajectory. And we also like to make sure that you as future students here have an opportunity to connect with our alumni and learn from them and all the experiences they've had. We have a really, really wonderful network. So I think I will end there so that we have time to move into our panel. Carol, did you want to segue into this next phase?
Yeah. All right. We have all of our panelists are on, and I'm not going to take the time to introduce them. They will be introducing themselves. And then I know that they have some prepared questions. So Kate and Susan and I are going to jump off. And then I think that's probably the best way to do it. And then they can just pop on and introduce themselves so they can start. Sound good? And we'll be back in about 15 minutes.
Yeah, why don't we say that we'll come back at about 8:05, 8 or so? What do you think?
Yeah, I'll pop on and see how everything's going around. Yeah.
I just want to make sure for those of you who like plan something else at 8, because we said an hour, like do not feel like you're missing anything. This will be recorded. We are always happy to answer chat by email. So no one should feel stressed that we're running a bit over time.
Yeah. And we'll come back at 8:05 for any questions for about 10 minutes. Okay. All right. So I'll turn it over to our student panel. Thank you for being here.
Thanks, Carol. I can introduce myself first if we want to just kind of go around. So my name's Lindsay. I'm a second year MPH student in the Nutritional Sciences program. And I did my undergrad in evolutionary anthropology and gender and health. So like Dr. Bauer said, I wasn't specifically focused in like biochem or bio or anything super, super heavy science-based, but I did take all of the prereqs. And yeah, I'll just start there and then let everyone else kind of give a short intro.
Great, thanks, Lindsay. I can go next. I was trying to unmute earlier, but my button was stuck. My name is Arohi Fulay. My pronouns are she, her. I am a third-year PhD candidate in nutrition, and I'm on the nutritional epidemiology track. I study food insecurity, dietary quality, and chronic disease risk in adolescents with Dr. Cindy Leung. My undergraduate degree is in biology and psychology from Cornell University. I am on a board for all the doctoral students in the School of Public Health, and I'm also interested in diversity, equity, inclusion efforts at the school. And fun fact is I'm originally from Pittsburgh, PA, which is only 4 hours from here. So nice to meet you all.
I could go next. Hi, everyone. My name is Jody Davis, and I'm currently a second-year MS student on the dietetics track. I am really interested in food insecurity and also the Flint water crisis that just occurred in Flint, Michigan. I'm actually working alongside Dr. Kate Bauer, who you all heard from tonight. She's actually my academic advisor. I work in her lab, and she's also my thesis mentor as well. So just a triple threat, and she's amazing. And a fun fact about me, I live in New Jersey, and prior to coming to UMich, I was actually an educator in New Jersey.
And so I am Elizabeth Zabst. I'm an alum. I just graduated from the NPH Dietetics program in 2021 in April. And I'm a part of the dietetic internship currently with the School of Public Health's cohort right now. And I'll finish with that at the end of March, and I will then sit for the RD exam and then become a registered dietitian. My background is actually very different. So I went to the University of Michigan and graduated with a degree in English a long time ago. And I lived in Chicago, had a background in pharmaceutical sales. So I came into this program in my 30s, taking some time off in between. So if anybody is in a similar situation of taking time off, I can answer questions on that as well. And then I think Jody and I chatted a little bit. So Jody's going to monitor the chat. So if you have questions, you can feel free to add in questions and she'll pop those in there. And the rest of us will kind of answer other questions. I'm going to work off of another document we have of questions to get us started. And we'll just kind of take a question or two each so we can get through as many questions as possible. So until we get some more in the chat, one of the first ones was just thinking about what extracurricular activities everyone has been involved in. So I know the three of you are still current students. So if anyone really wants to go with that one, feel free to chime in.
I can go first. Go ahead, Jody. Okay. So I'm part of the Dow Fellowship, which for those of you, probably most of you don't know what that is. I didn't when I came to Michigan. It's a sustainability fellowship. So I work with a client in Michigan and like work on sustainability issues. So that's a big extracurricular that I'm involved in. I've also been part of the Nutritional Sciences Student Association. Sorry, everyone, it's been a very long day. So those are like my main two extracurriculars in addition to just kind of like putting together events for the cohort and getting to know everyone.
And for me, I'm actually really involved with the DI working group that the Nutritional Sciences Department have here. We're working on different projects such as a repository, just so there could be like more DI work across all the curriculums within the school. And then also I am working outside at the Detroit Food Policy Council, and I'm their first Watson Fellowship. And for right now, I'm looking at low graduation rates in food insecurity, and I'm just trying to see if there is a correlation between the two with that.
That sounds great. Yeah, there's so many things to do and clubs and activities, more than you could ever fit into your schedule. So if you have questions about a particular one, feel free to let anyone of us or the coordinators know. Also, thinking about the summer internship. So for anyone that's doing the MPH, as you may have heard in the presentation, you'll do a summer internship in between your first and second year. This is one that I kind of want to answer just because I love my internship so much. So I participated with the Michigan Medicine Bariatric Clinic. And so it was actually during COVID summer. So first year of COVID, but I still was able to do nutritional counseling over Zoom and get a chance to learn more about bariatric surgery side of nutrition, which we do cover a tiny bit in a couple of the classes, but it was a really immersive chance to learn a lot more about it and also get a little taste of counseling before our actual like dietetic internship that I'm in now. So I highly recommend that experience. It was a cool one. And I don't know if anybody else wants to share theirs as well. Actually, it might just be Lindsay on that one because I think the other two didn't need to do one.
Oh yeah, that's true. So I actually did 2 internships over the summer. So one of them was as a nutrition assistant in the dining halls here at Michigan. And that one is basically a lot of database work, making sure that food allergy information is up to date in the dining halls. In addition, I worked on a sustainability project that's happening in the dining halls currently also. So that was one. And then the other one that I did was a research project with the University Health Service here, looking at if care for eating disorders is preferentially different virtual versus in-person care. So I did like a survey for patients who've seen a provider within the past year who've had a history of like disordered eating or eating disorders.
Thanks.
One of them was remote.
Oh, okay.
One of them was not. I just wanted to add that in there.
Okay, Jody, there's 2 questions in the
Yeah, I was just about to read them out. There's one specifically for you, Elizabeth.
Yeah.
So if you want to take that one first, it's just asking about, well, it says, Elizabeth, I am also taking some time off and working in the food industry. How did that time between undergrad and the beginning of your program influence your perspective in the field and your approach to applying for and pursuing your program?
So my time off in between, all the experiences that I had, I didn't realize at the time, but they were kind of gearing me towards this. When I was a pharmaceutical rep, my territory partner was a dietitian. And then I worked with, on the side, I did like bar fitness instructing, and I really loved helping people meet their goals. And, you know, all these little experiences along the way helped me realize what I actually wanted to do, because when I went to undergrad and graduated, I didn't really have that spark or passion to warrant, you know, taking on all these student loans for something. And it wasn't until I was older that I had an appreciation for cooking, for meal planning, for doing all that. So I think just being older and having more life experience gave me a new passion, and also a gratefulness to be able to be doing this and to attend classes and all that. I think as far as like approach to applying for the program, I think that experience, you know, having the professional background and knowing what it takes to present myself professionally in terms of a resume and an application and essays, and taking the extra time to be very detailed. I think that also came from my previous experience. So yeah, it was just a variety of things. I think that there is a benefit to being an older student in some regards. Just because if you're going back at this point, you're doing it for a specific reason and a passion. You're not going to interrupt your life for no reason. Not that you do that when you're younger, but I feel like being older, I just had a dedication that I might not have had if I had pursued this when I was younger. So I'm grateful for that. But you know, everything works out, you know, the way it's supposed to. So that would be what I would answer that one. And then I also got a direct message. I'm not sure if this went to everyone, and it's advice, tips for things to include in the statement of purpose. So I'm going to let somebody else answer that, since you all went through that process as well. Don't all chime in at once.
Yeah, no, I can hop in. So when I was going through the personal statement, one thing that I was really reflecting on was my why, and also kind of my upbringing and what led me on this path. So I would kind of focus on that, like what led you to this program, why Michigan, and why would you be a good fit for this program? So I think if you honestly highlight some of those, then you should be okay with your personal statement, but be as authentic as possible. Only because if you're kind of faking it, you could kind of read it through a personal statement. So you just want to be as authentic and genuine as possible.
Yeah, I would echo that. I definitely think being authentic to your story and your why was also kind of what I focused on. And I really just value, and I think the School of Public Health in general values vulnerability. So not being afraid to like be vulnerable in your personal statement, if that's something that you're comfortable doing, because it does help you like express that deeper meaning of why you're interested in the program.
Okay, it looks like I'm thinking about the time. And so one of the questions that I think is pretty neat to hear about is thinking about advice that you might have for nutritional sciences students, people who are thinking about applying to the program, what maybe you wish you would have done or known when you were applying. Any advice that you have that's more general?
Sure, so I can go. So I applied to grad school twice, once for the MPH, once for the PhD. And I think both times something that would have been really helpful for me is just paying attention to the culture of the school, in addition to like the ranking. Like if you're anything like a lot of the students that apply to school like Michigan, which of course is a fantastic school, you might be gunning towards a program because it's like the top program, and it's important. Like Michigan is a fantastic school, and we have a good balance of really good culture and really good academics, and that's a very unique situation. So for me, when I was applying, I got really lucky that I got into this program that's super highly ranked, and also has a very supportive culture and structure and a very collaborative environment. And that's why I came back for the PhD. So that's just something I wish I'd paid a bit more attention to when I was applying for master's and PhD programs when I was younger, because again, like it's helpful to think about how you fit in the program and how you feel as a student. Do you feel like you have support? Do you get along with your peers? That is just as important to your success as like the type of classes you'll take and things like that. So that's my piece of advice is look at the program holistically and not just, you know, the ranking. Although of course, Michigan's also way up there and it's the best of both worlds here.
That was really helpful, and I agree with a lot of your sentiments. So thank you for sharing that answer. I'm not sure if Lindsay or Jody want to chime in with anything else, or maybe why you chose Michigan, or if there's anything else that you'd want to add.
So for me, now that I'm in my second year, I think any advice that I would tell myself is just be open to change. For starters, I did start out on the MPH track and then I switched to the MS. And it's because I was able to have different conversations with faculty members within the School of Public Health and also in the NS department that actually made me solidify the path that I'm actually on right now. So just be open to change. It's good to have an idea of what you want to do, but also listen to your colleagues and have different conversations with people just so you understand the climate and try to figure out what exactly you want to do.
And I'm not sure if anybody else has any final questions for us, but I think Susan and the other moderators are back as well. So we can sign off if no one has anything, but I just want to say good luck with everything. And I am so grateful for my decision to come here, and I am loving the internship as well. It's just continued my great experiences at Michigan, and I hope that you all find exactly where you're supposed to be as well.
Nice to see you, Elizabeth.
Nice to see you too.
Oh, I know everybody, it's been a long day for all of the students. I know because 2 of the students are in my class, so I know you guys are probably ready to go to bed. Arohi, I'm not sure what you've been up to, but I'm sure you're doing incredible things. Elizabeth, you probably had your dietetic internship today, right? Yeah, so thank you. It's late. We really appreciate your time, and I'm sure your insight and your perspective and your honesty and just, your experiences are so valuable. Thank you. We can't thank you enough.
Yes, thank you so much. All right. Okay, all right. Thanks, Jody. So Jody mentioned that if anybody wants to get in touch with our student panel, you can also email me and then I can connect you with them if you didn't grab their emails off that one slide with all that information on it.
I know there's been a lot of activity in the chat. Oh, and my dog is here wanting to eat something. Sorry. We might, I know some of those messages go back quite a bit where we stepped off for a minute. So, does anybody have anything that didn't get answered? Feel free to either unmute or put it in the chat. We can stay on for the next few minutes.
Yeah, there's a question in there, Susan, that maybe you want to answer.
Sure. Is it possible to participate in a work experience similar to a dietetics internship before beginning a program? That's a really good question. And, perhaps we could talk a little bit offline. You could send me an email about that. But so the problem is that work experiences related that would be similar to a dietetic internship require a certain level of course knowledge and knowledge within that field of whether or not it would be medical nutrition therapy or whatever placement you're interested in. So generally what we'll tell students, and it really depends, Erica, on where you're living, but if you would have the opportunity to perhaps shadow like a registered dietitian to learn a little bit more about what they're doing, it can really expose you. I mean, there's a variety of RDs working in different fields out there, and everything from clinical to community to food service. So if you could find somebody in your area who is doing something that you might think that you would like to do, being able to spend some time with them is ideal. Now, we are living in COVID right now, and many people are still working remotely. So, possibly even doing some informational interviews with dietitians that are working in the field in areas that you're interested in. I do that type of thing all of the time, so I know there's lots of people out there, and I can connect you with people through the Academy of Nutrition and Dietetics too. So I'll put my email in the chat, and maybe send me a message separately, and I can give you more detail.
Okay.
And then we have a question? Yeah.
we have a hand raised, yes?
Hello, yes, me.
Yes.
I have a question. I'm a master's student and I'm applying to the PhD program in nutritional sciences. I have a question about the advisors. Should we secure an advisor before we start the PhD program? And how do we know that the advisors have funds? Honestly, I contacted 3 advisors so far, and all of them, unfortunately, they are not hiring PhD students because they do not have funds. So is there any way to know which advisors are available, or who can I work with?
Yeah. So this is very tricky, and we wish we had more money to take on, because we do have far more highly qualified, exciting applicants than we have funding for. And I think there was another question in the chat about this. It's unfortunately never sort of black and white where we can tell you this person is never going to take a student or not going to take a student this year, and this person is, because also every student, comes in with unique circumstances. In-state students do cost less, the tuition is lower than out-of-state students. We do have international students who have received funding from their government, so that helps. Or we have some students who, have fellowships that allowed them to go on to graduate school. So it's, again, never, sort of like, yes, I'm taking someone, no, I'm not. It might depend on the student, on the time. I don't know if I was someone you emailed. For a couple of reasons, I'm not going to take a student next year. I'm going on sabbatical. I don't quite have the right funding. Okay, so given that, unfortunately, what I can, I really think, look at the faculty members' interests, right? And look across, I'm never, maybe I shouldn't be telling you on recorded to look at other programs, but that's the reality, right? A PhD should be about, what do you want to do? What do you want to learn? And if at Michigan, there is not a good match, or there's not the right funding opportunity, look at other schools in the US, right? University of Washington, University of North Carolina, all also have great nutrition programs. I am happy, I've chatted with students and I'm like, go call my colleague at, wherever, because I know they have funding and I know they're doing that work. Okay, so that was a big thing. Because the bottom line is that when you do a PhD, we pay your tuition, the program pays your tuition, and the program pays your stipend. So it comes down to mentor match, and it comes down to funding. So yeah, I think just, if keep reaching out, keep exploring opportunities and thinking, is that something that I might want to focus on for 5 years, 10 years, my career? And look broadly, because PhDs are harder to get into.
Yeah, thank you. And hope to join you soon.
Let's see, there's a question about, is it possible to commute to campus? How many days a week are students in class in a typical semester? Looking to commute from the west side of the state. Susan?
Well, we actually have a number of students that are commuting. Some of it related to COVID, and some I think every year. I would have to say the longest commute we've seen is about an hour. An hour in good times can be an hour and 45 minutes to 2 hours in the middle of winter. Commuting from the west side of the state sounds like that would be a challenge. Most semesters you will need to be here for at least 4 days. 4 out of the 5 days, Monday through Friday. There's an occasional semester where there's 1 day during the week. And unfortunately, we can never really guarantee that, because as you saw in the curriculum that you're taking, not only do you take courses within our department, but you're taking courses in all different departments, and they're changing when courses are offered, and we don't have control over that, as well as courses you as a student in our program are also able to take any course across the University of Michigan's campus, as long as it's a graduate course. So you might be also taking courses in other schools and colleges. So That would be, there is a Masters of Public Health online program that we have. And there are some elective series that are nutrition related, but you would graduate with a population health sciences degree in that program and not get very detailed specific nutrition content. So if you really are interested in nutritional sciences degree, you'd really have to be a residential student. And I would not recommend living more than an hour away. So unless you had some type of an arrangement where you had a place to stay for a few days, during the week and then could go back home. But again, not knowing your circumstances, it's hard to know what's possible.
I've had a couple advisees who are living, closer to Detroit because of their partners or whatever. And it's absolutely possible, but I do hear like, oh, I don't get to stay for the club or, group activities that I want to, or I'm really tired. So yeah, if you could have a crash pad in Ann Arbor, it is probably ideal.
Yeah, and we have a really interesting mix of students. So we have students fresh out of undergrad. They're just plowing through and they're taking no breaks. And then we have students that have taken anywhere from like a 1 to 3 years off. They might have done AmeriCorps, they might have done Peace Corps, they might have traveled, they might have done a variety of experience or started a career related to their undergraduate major and found that they really want to pursue nutrition. And then we have a bulk of students that have taken anywhere from 7 to 15 years off, and they may have families, they may have children, they may have had careers in art history. There's just a wide range of students, and all of those three broad groups of students are fun to be around for different reasons. So, at different points in their life. So some have more flexibility to be able to stay in Ann Arbor, and others have commitments outside of Ann Arbor, so they need to commute. So it really depends upon, it's so individual. Any other questions? We do still have quite a few people on, which is nice. I know we did rush through many of our slides, so.
You can see we're willing to tackle anything.
Yeah, I guess too, we might be, or probably will be planning some additional webinars this fall or maybe early January. So you'll get any of that information from us since you joined us today and you're on our list. So
yeah, there's we usually will do one. There's usually a lot of questions related to dietetics and the dietetic internship. So we usually will do like a 15-20 minute little webinar so that you can get those specific questions answered. I do see another question in the chat. There's a couple of questions. Should PhD students teach or work as research assistants to secure their funds? Well, if you are admitted as a PhD student, and Kate can comment more on this, your package will be very unique to you and your mentor. So you could have some of the semesters where you are a GSI, where you are teaching one of our courses or a course in the School of Public Health or across the university. You could be appointed as a GSRA, where you're responsible to do about 20 hours of work alongside the mentor that is actually paying your tuition, the faculty member. You could have a fellowship that pays for the semesters, or a fellowship that pays for some of the years, but not the entire PhD. So it really is individualized. Kate, did you have anything else to add to that?
No, yeah, just that it is always some combination of research and teaching, and we try to get everyone whatever scholarships or fellowships they can, but it does come down to that individual, agreement between the mentor and the student.
Right, and our department too, and we try and squeeze money out of all rocks. So Carol answered the question about the GRE, continuing to waive that. So
no more GRE for the MPH.
Right, definitely gone forever for the MPH, on hold for the MS and PhD, but if you're interested in applying for 2022, you will not have to take it. I see here the question for 2023. Wow, my dog is really being a pain today. He's usually pretty quiet.
Yeah.
Well, it looks like no other questions in the chat, so we could wrap up.
All right. Well, as we keep saying, just please, we're here to answer your questions. We want to help you make the better your application, the easier this whole process is, and we want to help you. So just reach out with any questions.
Thank you, everybody.
All right.
Thank you.
Night.
Good night.